So it's something many doctors have been bracing for, knowing the pandemic has caused a fear of emergency rooms and a lack of in-person health care. A pediatric cancer surgeon is speaking out about an alarming trend that she's now seeing in the young patients at her hospital, something she calls a tragic consequence of COVID-19.
One of the most common things I treat is brain tumors that occur in the cerebellum or the back of the brain.
I told him that I found another shunt for him.
Dr. Sheila Singh is a pediatric neurosurgeon at Hamilton's McMaster Children's Hospital, and what she's now seeing 20 months into the pandemic is nothing short of devastating.
I literally have not seen cancer this widespread or this advanced. And really is because of the diagnostic delays. So the COVID pandemic restrictions provided just enough time to push a lot of diagnoses into the untreatable or advanced stage range.
I mean, you're saying that you're seeing kids at end stage cancer when they could have been saved.
Yes, there are patients that have suffered this degree of diagnostic delay.
The oncology ward at McMaster normally sees 30 to 60 new diagnoses a year, and according to Dr. Singh, right now almost every case of cancer is further along than it should be. She recalls a bad feeling she had back in the early days of the pandemic when the hospital was a ghost town.
The irony wasn't lost on me that people were scared to come to the hospital for fear of catching COVID in a healthcare setting when I had never seen the hospital this clean before in my whole life or this empty. And I think that combination of the fact that parents were scared to come to the hospital and then assumed that virtual visits still constituted a proper doctor's appointment meant that a lot of things went missed and undiagnosed.
Here in Toronto, Sick Kids Hospital has been seeing an increase in visits to the emergency department with concerns that could be addressed by a pediatrician or family physician. The hospital also tells CityNews that staff are seeing patients who have had limited access to in-person primary care that has contributed to the progression of disease. Overall this year, fewer people are being diagnosed with cancer. Ontario Health reports numbers are down by 10% from pre-pandemic levels, and these are cases that are being missed.
I really, really hope that we examine properly and really study the collateral damage that has happened so that we can avoid this in the future. If I could buy back that 6 months for so many patients, then they could have had a different outcome.
No, Dr. Singh says virtual medicine should be limited and simply used as a screening tool. She says it's time to make in-person checkups a priority once again, or else diagnoses will continue to be missed.